Camille. Come here. Camille wants to say hi. Say hi to the YouTube people. Look, Camille, say hi. Say hi. Okay, will you let me make my video now? Alright, scoot off. You can stay here in the room with me, I don't mind. Okay, so what I wanted to talk about today was something called the water cure. Now, since my high blood pressure is back, which I hate that it's back, I'm going to try to do everything I can to get rid of it. And one of the things I was looking up was magnesium, because magnesium is a mineral in your body that if you don't have enough of it, your muscles, everything that's constrictable will constrict. So think about when you go to the hospital with a heart attack, they give you magnesium. When you go to the hospital in preterm labor, they give you magnesium because it relaxes any muscles that will contract. Now in your arteries you have these little, like in the endothelial lining, you have these little kind of like muscle fibers, and they'll stay contracted in your veins if you don't have enough magnesium. So what I want to talk about is the water cure. Now the water cure is by a man named Dr. Batman Gulage, and he's passed away now. But the basic thing of it is that all disease and illness, even cancer, can stem from dehydration. Now basically if you're dehydrated, your body doesn't have enough water, so it takes water from other places, from your organs, from your bones, from your skin, everywhere, to supply the water to the blood so that it can pump around your body. If you don't have enough water, you can get high blood pressure because your heart has to pump harder to make the blood go around. So, and your veins will constrict because they need to squeeze tight around this blood. So basically how you do the water cure is that you drink half of your body weight in water. So if you weigh, say, 100 pounds, you would drink 50 ounces of water. Now the water you choose is important. You can use distilled water, which is just water you leave on the counter overnight. You let the chlorine get out of it. It'll evaporate. Or you can go buy specific bottled water. The water mentioned, the best water so far that's mentioned is Fiji water. You can buy it off their website, and you can find it at different stores if you look around a bit. And the other thing that you have to have is something called sea salt. Now you use a 1/4 teaspoon, a 1/16, which is if you take a 1/4 teaspoon, it's 1/4 of that. So you take your 1/4 teaspoon, you divide it in 4. For every 8-ounce glass of water, use 1/16 of a teaspoon of sea salt. Now you don't just get regular sea salt, you have to get unrefined sea salt, which means it's kind of a sea salt that, if you can see in the bag, it looks like it's wet. Can you see that? I don't know if you can see that. It looks very wet. And it's kind of grayish. It's not clearly like regular salt. Regular salt is not actually regular salt. It's salt, but it's been processed and all the minerals have been removed. So you don't have the trace minerals that you have in the sea salt. And it has a balance of calcium and magnesium. And those two things inside your body will help deconstrict any of your muscles. And I have to say that my blood pressure has gone from being about, when I first started monitoring, it was like 140/85. Say 144/85, and that's with the medication. The medication brought it down to maybe like 135. I never got in the 120s, but now the last couple of days it's been like 114/69. Last night it was 98/52, which made me a little bit worried because I didn't want to take medication after that because then it would go too low. So I'm definitely going to continue with the water cure and see what happens. A lot of people say after 2 weeks of doing the water cure, they're off their blood pressure medication. So I'm going to still go with the raw food. And I am going to incorporate other sources of magnesium. You can use magnesium oil also, and you can use foods. Obviously food is the best place to get it. It's just difficult to find it. You're going to get it in oat bran, all bran. There's some in the green leafies, but you'd have to have a lot. There's a bit in milk. And you also want to have some vitamin D. Not vitamin D2. Don't have vitamin D2. Use vitamin D3. Now, I'm not a doctor, so obviously, before you do any of these things, you're going to speak to your doctor. You're not going to stop taking any medication just because you watch a video about water cure. try the water cure, start doing it. It's really great for arthritis. It's people have talked about curing cancer with the water cure, so look up Dr. Batman Galij and the water cure and see if it can help you. So I will definitely update you on this, and have a really great day.